Hello, my name is Dr. Mia Miller, and I am a gynecologist. I have worked with young women and adolescents between the ages of 10 and 22. I've been working in this field for 20 years now, and I have 3 different clinics across Texas. One clinic in particular is located in the southern region of San Antonio, Texas. This clinic specializes in the health of women, the education of health conditions, and a comfortable atmosphere for women that come and see my practice or any of my practices around the state. Over the past few years, I have recently seen a large portion of the individuals who come and see me having a certain infection that affects a lot of women in our country. Sexually transmitted infections, or STIs, have been happening with a lot of my female patients. For every 100 patients I see, on average, 58 of them have come to me with some sort of STI. For my talk today, though, however, I will be targeting one infection in particular that has been affecting my patients, and that is genital herpes. It is the most popular STI in North America. They are ulcer-like sores that are transferred through sexual activity and located growing on genitals and other areas of the skin. Symptoms of this disease include inflammation on areas of a woman, including the vagina. For men, these warts and inflammation can happen around the testes and other areas of the body. The reasoning of these symptoms have to do with the transfer of pathogens, which allows bacteria that the body cannot defend to enter the bloodstream. There is no known cure for herpes, which means a person who gets this infection will have it for the rest of their lives. For most women that come to see me with this infection, I prescribed antiviral medications such as aciclovir. I have encouraged them to have protected intercourse and to let their sexual partner be fully aware that they have this infection. I require them to come see me monthly for checkups to see if the inflammation has gotten worse or better or stayed the same. For my male patients, I refer them to a urologist since my specialty is in gynecology. I have one patient in particular that I still see monthly. She's a female, age 22, and she is a Caucasian woman. Her family is middle class, and she has no previously health issues other than a mild case of asthma and a peanut allergy. I diagnosed her with herpes when she was 16 after being untreated for 3 months. I prescribed her aciclovir to prevent the replications of her infection, then valacyclovir to prevent cold sores and other inflammation, since the inflammation is under control. In closing, I believe that there should be a light shining on this infection that a lot of women in our country still has to this day. Related to the issue, I strongly suggest having monthly check-ins with these specific patients to see if the inflammation is under control. Education is power, so herpes needs to be a required issue that is discussed in all sexual education classes. There also needs to be a broader discussion in regards to this infection, considering that this is the most common STI that individuals in this country could get. Having a complete understanding of this disease and empathizing with your patients is essential for those who may be treating patients with this infection. Other problems that need to be solved is the stigma of sexually transmitted infections and affordable health care for both men and women who find themselves with these infections. Thank you for your time.